A coronavirus outbreak has hit Melbourne's Royal Children's Hospital with a newborn among the latest to test positive for COVID-19. The baby was being treated in the neonatal intensive care ward, where a health worker and two parents have also been infected. Authorities will now test everyone who spent more than 2 hours in the ward since July the 12th.
Elsewhere, outbreaks continue to spread amongst Melbourne's aged care homes, and Sydney's cases are also growing, with more restaurants and pubs identified as possible infection points. Let's get more from our reporter Steph Arias in Melbourne for us. Lily Mayers in Sydney, good morning to both of you, starting with you, Steph. Victoria reached that grim milestone yesterday with 532 new cases and serious concern about that neonatal ward this morning.
Yes, good morning, Michael. I'm here at the Royal Children's Hospital where, as you say, a baby in the neonatal intensive care unit has tested positive to coronavirus, along with two parents and a healthcare worker. And of course, as you say, this is really concerning news because the NICU is where the most seriously ill and premature little babies in the most fragile state of health are cared for. And as a result of these positive cases, 7 patients, 3 parents and another 17 staff have also been identified as close contacts, and they're now in isolation and getting tested. And the health department also wants to test anyone who was in the butterfly ward for more than 2 hours from July the 12th. Now, as I mentioned, these are new cases among the 532 record daily tally for Victoria since this pandemic began, which is some really grim news indeed, including 6 more deaths. A man in his 50s is amongst those who lost their lives to coronavirus. There are now 245 people in hospital. 44 of those are in intensive care, and the state's Chief Health Officer, Professor Brett Sutton, says that he expects that number to significantly increase over the coming weeks. And that's because of the 4,500 or more than 4,500 active cases here in Victoria, more than 680 are linked to aged care centre outbreaks that involve some 61 aged care centres. And we heard some really bad figures, like a tripling of the number of cases in places like the Epping Gardens Aged Care Centre, clusters in the 80-pluses in both St Basil Home for the Aged in Fawkner in Melbourne's north, as well as Estia Health in Ardea in Melbourne's west. So Brett Sutton says that it's an inescapable fact that many of these people are at significant risk of dying. Now, we're nearly at the halfway point of this 6-week lockdown here in Victoria, and while the government isn't talking about extending any of those lockdown measures as yet, the Premier Daniel Andrews says it's very clear that these numbers are caused by people who continue to go to work even when they're sick and are spreading the virus. And he says that if this behaviour doesn't change, he might have to look at shutting down entire industries like meatworks and logistics and warehousing.
Those numbers are still way too high. Everybody agrees on that, Steph, but there were suggestions, official suggestions yesterday, that we may just have reached the peak of this current infection outbreak in Melbourne.
Yeah, so Brett Sutton said that Health Department modelling showed that we had actually reached the peak yesterday. However, he was quick to say that he wasn't going to come out and say that. He wanted to wait for a couple of days to see what happened with the figures. And in fact, he's concerned that the numbers will continue to increase given the very volatile nature of those aged care outbreaks.
Steph Arias, thank you. Let's go to Lily Mayers in Sydney. So, Lily, good morning to you. What do we know about this latest restaurant closure in Potts Point?
Good morning, Michael. Well, 2 new cases have been linked to restaurants and bars in Sydney's east and the southwest. One is a staff member from the Apollo restaurant here in Potts Point. The restaurant's now been closed temporarily for cleaning, and anyone who visited between July 23rd and 24th has been urged to self-isolate. The second case is a patron who visited both the Mounties Club at Mount Pritchard and the Pritchard's Hotel between July 23rd and 25th in Sydney's southwest, and health authorities are again urging anyone who was there at a similar time to self-isolate. There are now 70 cases associated with the Thai Rock restaurant outbreak in Wetherill Park and 9 cases linked to the funeral cluster in Sydney's southwest.
Meanwhile, that Black Lives Matter rally is set to go ahead later today, despite the Supreme Court officially prohibiting it. So that'll be a potential flashpoint this afternoon.
That's right, Michael. The ruling means that anyone who attends the protest in Sydney today runs the risk of being fined for breaching COVID health orders by gathering in groups larger than 20. Protesters say despite the ruling, they're intending to meet and demonstrate anyway. That's against what health authorities and the government have urged them not to do. Here is what Federal Health Minister Greg Hunt had to say earlier in the program.
Please do not go. Express your views on social media, a silent vigil outside of your place of residence, whatever other means, but not gathering in large groups.
Greg Hunt there, Lily Mayers and Steph Ferrier, thank you both so much.
Workers on the front line of the battle against coronavirus have been awarded 2 weeks pandemic leave. The Fair Work Commission initially rejected calls for the leave, but now it's important workers in the industry aren't hit financially if they have to isolate at home. Unions say around 250,000 workers will be entitled to the new leave. They're calling for the measure to be extended to all frontline workers.
South Australians hoping to travel home from Victoria have only hours remaining to make the trip before new border restrictions take effect. From midnight tonight, SA residents will no longer be able to enter the state from Victoria. People in border towns will be able to travel between the two states for work, education, food shopping or medical care as long as they have been designated members of the cross-border community.
My primary responsibility is the people of my state, and at this stage we've got to have that hard border arrangement in place.